All right, here we go. Welcome, everyone. My name is Hannah Campbell. I am Senior Assistant Director of Admission here at Massachusetts College of Pharmacy and Health Sciences. And I'm joined here by a group of our current students who are here to kind of share their insight on our Doctor of Optometry program and hopefully answer a lot of questions that you might be pondering as you've been moving through the application process. So without further ado, I'd love to have them introduce themselves to you. We'll start with our fourth years, if you guys don't mind giving your name, what year you're in. Well, I guess I gave that away already, and where you're coming from.
So my name is Brianna. I am a fourth year student and I'm originally from Ottawa, Canada.
I'm Samir. I'm a fourth year optometry student as well, and I'm from Milton, Ontario in Canada.
And then our third years.
Hi everyone, my name is Miriam. I'm a third year optometry student and I'm from Upton, Mass, which is right in Worcester County.
Hi everyone, my name is Sierra. I'm also a third year and I'm from Milford, Connecticut.
And lastly, our second year.
Hi everybody, my name is Delasha and I am also from Canada, but I'm from Alberta.
Excellent. So thank you guys for being with us here to kind of share your expertise today. So I guess the first question we always love to start these panels off with is, why did you choose MCPHS? The big one.
You go first.
Yeah, jump in.
So I originally chose MCPHS. It was kind of like our acceptance years during COVID, so we didn't really get to tour the school or anything like that. I applied to 2 schools in the States and I just really enjoyed the interview process at MCP. I really liked how there was a professor involved and they kind of just related to me and we had more of a discussion rather than a scary interview, I guess. So I just really enjoyed kind of the environment and the discussion that I had, and I got to meet one of the profs and just already get acquainted with them, which was really nice.
That's great.
I had a similar experience as well. I also felt it was very friendly, family-oriented, welcoming environment during my interview. I again interviewed virtually, I guess 4 years ago now. So I didn't really have the experience to just come on campus and like explore and like see everything. But with the virtual aspect, I felt it was a great welcoming environment across the country.
Awesome. Thank you guys for sharing. I think we have a really good group here today. So I want to kind of ask more about what your transition has been like to MCPHS. I know some of you are more local to New England, while quite a few of you come from Canada. So did you find that to be a big culture shock, or was it pretty smooth in the process?
Maybe I can give a American personality first.
Yeah.
It's a little bit easier of my transition. I actually went to undergrad in Worcester, so in terms of like culturally, that wasn't really a big change for me. But in terms of academically, I would definitely say just the transition from undergrad to grad school was just a little bit of a new experience. So definitely a different way of studying, more time spent in the classroom, more time spent studying. So that was kind of an adjustment that took maybe a couple months. Maybe I'm still doing it to this day, but just a little bit of navigating and figuring out what works, what doesn't work, study styles, things like that.
And the biggest question that we get often from students who've been newly admitted into the program is how they can prepare. Because sometimes they're waiting a couple months before terms start and they just want to hit the ground running. What would your advice be to these incoming students as to how they can prepare for this 4-year rigorous doctoral program that they're about to embark on?
I'll go
I can
first
explain a little bit on that. Oh,
Okay,
sorry.
no, go ahead, go ahead.
Okay. I just say like one thing that I found to be very important is like self-care in optometry school, because you need to prioritize your health in order to be successful just across the board. So I think it's worthwhile to kind of set like those consistent habits, like sleeping schedule, exercise routine, whatever it may be, like taking time off, just so that you can carry that with you into optometry school and it won't be as overwhelming. Like right from the start, I feel like I didn't do that fully. And so it was a little bit of a transition for me personally, but I'm really like my routine that I set for myself early on is like I'm carrying with me till today, and it's been really helpful.
Great point.
Yeah, okay, I'll go. I was just gonna say that like I'm the closest to having just started, I guess, in this group, but I just wish that I had taken it really easy like the first summer before I started, because really this is the only break you're gonna have for like the next 4 or 5 years, depending on how long your education is. And whether you do residency and stuff like that. So just enjoy the break, just enjoy the summer, don't think about school. And I agree with what Miriam said about like having those habits about self-care and sleep and stuff like that. But don't worry about school, because I've had people ask me if they should start like practicing optics from YouTube or something. And I'm like, please don't do that. Like just take the break, enjoy your summer, and you're gonna be well rested and happier for it. And if anything, perform better. So just, yeah, chill out.
We hear that as very common advice for a lot of our programs too, since this is mostly an accelerated campus. So I'm glad to hear it from our optometry students as well. Just take the time to rest and, best prepare yourself for what's to come. Now, can you guys tell me a little bit about what you like to do in Worcester and what it's like living in Worcester, especially those of you who are kind of transplants to the city at this point? What do you guys like to do in your free time in the city? Come on, Smear. I know you got an answer for this one.
I'll speak for both of us because we did everything together, honestly.
Yeah, let's hear it.
Coffee shops, food outings, just kind of like exploring around, going to Boston a little bit in your free time when you do have the free time, especially towards the beginning of the semesters. And just kind of exploring little gems in the city that you're kind of been, like you said, transplanted in for like 4 years. So definitely worth it. And you'll definitely miss it once you leave. I can speak from experience.
Definitely agree. We've explored several like bakeries, restaurants, coffee shops. There are a lot of different like local restaurants within Worcester that can only be found in Worcester, especially where our school is on the Worcester campus. You can find a Burger King anywhere basically, but like these bakeries and stuff are like very true and unique to the Worcester community. So definitely try them out when you do come on campus.
Great. And have any of you guys attended any of the sporting events, whether it be the Woo Sox or the Worcester Railers hockey team?
I personally love the Woo Sox. I've been too many times. That's our AAA affiliate of the Boston Red Sox right here in Worcester. I've also been to a couple of our Worcester Railer games, so there's a lot of different activities. I've also been rock climbing and ice skating in Worcester, so if you're more of a adventurous person, sporty person, definitely take advantage of those opportunities as well.
Excellent. Now, I think a few of you here currently or have previously lived on campus. Can you talk about that experience? Is there a lot of optometry students from your cohort who have lived on campus as well? And what did you like about it?
I definitely like the convenience, of course. MCPHS does have like several different types of student housing. I live in the 10 Lincoln Square building, which is like my place I stayed at was on the top floor, and then classes, labs, and clinics was on the first floor. So it was convenient, kind of like not worrying about getting ready so early, avoiding the snow, the rain, the cold. Given I'm from Canada, I hate the cold and the snow. So it is easier in that sense. So it was a convenience in that way, but I know like several of our friends lived elsewhere. They chose to have different amenities, different I guess advantages or limitations of certain residences. And then few of our classmates also lived at off-campus housing where they had to organize their own like utilities, parking, rent, everything. So it all kind of depends on the lifestyle you are looking for and how you want to, I guess, spend your next, 4-ish years here.
Great. And probably another, actually, Brie, it looked like you were about to jump into, so go on.
Yeah, I was just gonna say, like, it's also super convenient in the sense that, like, it's all furnished for you, so you really don't have to bring anything, especially if you're making a big move, like Samir said. Like, it's just all there for you, and it is very convenient. And like you said, there's so many different options. You can go from like a single tiny apartment to like an apartment style complex like you'd find at any, you know, condo. So there's tons of options, and it's pretty easy to go.
Great, thank you guys. And I have another question that might be best geared towards Samir. Do you find that it is important to have a car with you here in Worcester, or is it possible to get by with just public transportation?
So Worcester, again, you probably see it's a very not walkable, but like more so everything kind of nearby. The public transportation system has been free since COVID, and I think it continues to be free for the next few years. So I don't have a car for myself. I use the public transportation, which is somewhat reliable. Most of our classmates who do have cars, they're always offering to take us places, whether grocery shopping, sightseeing, whatever. I'm a fourth year right now. I don't have a car, and I take the train to downtown Austin every morning, every evening for clinics. So I've done it for one semester, and I'm planning to do it for one more semester for 4 months. So it is doable. It may be convenient to have a car, but you don't need to have a car.
Absolutely. So definitely a convenience factor to be able to just hop in your car and go to everywhere you want to go. But if you're looking to save some money, you know, you don't have to pay car insurance or a parking spot or anything like that. It's definitely doable if you are thinking about it. So next, I want to kind of transition into the community here at MCPHS. You know, of course, we are a healthcare specific institution, and we have a lot of other healthcare programs here. So can you guys talk to us a little bit about what collaboration you've had with other programs, especially through interprofessional education?
I can jump in on this one. So I remember for our first year, we had one where we got in circles and groups with other members of the other programs, like students from other programs, and we all had to compare and contrast our roles that we all could do, like in terms of our scope of practice in Massachusetts or in any other state. So it was really cool. So we like learned about each other's careers, what we can refer for, what we can't refer for, like to each profession. And it was kind of a competition. Whoever would be like the fastest, or whoever would solve the most Quizlet questions about each other's careers, they won a prize. So not to flex or anything, but our group won like the Dunkin' gift cards. That we won what was on the table. So it was really cool. We learned about each other's careers. I think it's really important, just because a lot of professions don't really know everything that optometrists can do. And so us educating other programs and them educating us, we're able to have those dialogues. And then when we're out in practice, we're well informed and just simultaneously. So that was a really unique experience.
Awesome. Thanks, Miriam. And how about involvement in some of the different clubs and organizations on campus? What are you guys involved in outside of academics?
So there was the Chaos Club, Canadian Association of Optometry Students. Bree, myself, and a few others, we kind of like reestablished the club of when we were in second year, so 2-ish years ago. Basically trying to foster a Canadian family for like the incoming and the current Canadian students, because there are actually so many Canadian students in the different classes that we have at MCPHS. We planned like Canadian Thanksgiving, which is held in October. We held Canada Day celebrations in July every year for every student, open to everybody, but more so like celebrates the Canadian celebrations of the two different holidays.
Excellent. What else? Miriam and Sierra, I know you guys are pretty involved on campus.
Yeah, Bree and I are both members of SVOSH, which is Students Volunteering Optometric Services to Humanities. Try saying that 5 times fast. But really, our role is to provide different services to kind of like the Worcester community and beyond. So one of the main events that we've kind of made annual now is our trip to Framingham, Mass, which is about 40 minutes away, where we partner with Remote Area Medical, or we call them RAM, and we provide vision services along with RAM will actually provide like dental, medical, women's health, and even pharmacy. So we're able to do that through them, which is really cool. Bree can talk a little bit more about it, but she just went on a trip as well through SVOSH. And we do other events like this year, we're putting on Dining in the Dark, where we'll actually have everyone blindfolded. So they'll learn what it's like to be someone who has lost part of their sight. And then they'll try to eat spaghetti in our ballroom, which will be pretty fun.
Does sound
Yeah,
fun.
so we associated with RAM, like Sierra was saying, and we actually went to Jellicoe, Tennessee back in March. And on the trip, we basically, like she said, gave free eye services to the people of Jellicoe. Jellicoe recently, I think, either closed or only reopened their only hospital in the area. So they don't really have crazy access to care at all. And it's very close to the border of Kentucky, I believe. So a lot of people came from there as well. And so I believe we saw over 200 patients or so in about 1.5 days. And we helped a lot of people out, and it was really cool. You can get your glasses made on site. Or if they're not available to make on site, they mail them to you. So it was just really cool to like help out the area. And all of the people volunteering were actually staying in the same like comfort inn that we were all staying in, and it was really funny. So it was just a really great experience to like help the community.
Awesome. Always a big fan of our SVOSH trips that happen on campus. So of course that helps our greater community, I guess, throughout the US, as we mostly target like the Appalachia areas. But tell me a little bit about what you guys have done in terms of helping the Worcester community. Have you participated in any fundraisers and drives or community outreach?
One of my favorite events that I've taken part of is Walk Fit, which is part of our Low Vision Club. So this partners with a group called Walk Fit. And these are people who are known as VIPs or visually impaired persons. And they teach you how to become a sighted guide for the Worcester community. So I've gone to Elm Park and St. Vincent's Hospital. And for the first one, they'll actually blindfold you and show you what it's like to kind of walk around, learn how to use a cane, things like that. And then once you're kind of initiated, they'll actually teach you how to be the sighted guide and guide someone around an area. So it is really unique. You don't go into low vision until you're a third-year student, so it kind of can get you that early exposure if you start at your first year, and it gives you a new appreciation for people of different levels of sight.
Yeah, Walk Fit was one in particular that I know our recent graduates were very passionate about and wanted to see continue. So I'm glad to hear that you're continuing that for them, Sierra, because it definitely is a really good cause. Now, I'd like to kind of ask you guys to share, mostly going to be recollection, at least for a couple of years, but what a typical day in a life looks like, for each year throughout the program. So, Miriam, would you be able to tell us what a day in a life looks like for a first-year student, from what you can remember, at least?
Sure. So I remember first year, it's kind of like the last year of undergrad, just lectures and labs throughout the week. And that's pretty much it. Just lectures and labs mostly. Yeah. And so there's like some teachers put on some review sessions and things like that, but it's mostly lectures and labs.
And when did they start getting some clinical experiences in first year? Did you sit as a patient yourself when you were first year, or do some observing?
Yes. So we had to do a couple mandatory like observations in clinic during our fall semester, and then I think during the spring and summer they were optional. Where we can, so first, like when we did it first semester, we had to shadow in primary care, and then for second and third semester of first year, we got to choose kind of the specialty clinic that we wanted to shadow in. I remember I shadowed in contact lens clinic, and I had no idea. They were like throwing out like different terms like rotation 15 degrees this way, like all the different mnemonics. I had no idea, but it was just so cool to sit in on that exam. I remember like the patient had keratoconus, and I had never even heard about it, but just seeing the effect that the student had on the patient's life was really amazing, because he was an engineer, and obviously his sight is very important for that position that he works in. And so just getting fit in these specialty contact lenses was just like, it was really cool just to see what was coming up in the program. So that's what stood out to me.
Yeah, definitely a good introduction. And Sierra, would you be able to tell us what a year in the life is like, or I guess a day in the life is like for a second year student?
Sure. So as you go up in years, you'll start to notice that you start to intertwine more clinic. So the fall of your second year is when you'll actually start in clinic, which I saw some of our second years starting today, which is exciting. So really, you're only in clinic about once a week, but you're also rotating through our optical, so you'll get a chance to help people pick out glasses, a little bit more about the insurance side of glasses and things like that. And then you also get to go to the local schools in Worcester and provide vision screenings, which is a cool service we offer as well. You're still going to be in the classroom, still going to be taking those labs. So kind of learning to juggle a little bit more, definitely doable. And then kind of as you go up throughout your second year, it is pretty similar. You'll just slowly add a little bit more clinic.
And how about Samir for our third year?
So in third year, mainly you get added to more clinic time, your fall semester of your third year. So where Miriam and Sierra are right now, you're in clinic several times a week with classes just on Fridays. In clinic, you're put into specialty clinic, whether it's glaucoma clinic, pediatrics, contact lenses, low vision, vision therapy, binocular vision. I'm pretty sure that's it. Plus, you also do primary care clinic at our affiliated health centers. So we have health centers in Worcester, which is like 10 minutes from the main building, Framingham, about 40 minutes, and then Milford, again, about 45 minutes. There, you're primarily doing like comprehensive general eye exams to the less affluent, more of a Hispanic, Portuguese population. So 9 times out of 10, you're doing an eye exam using the interpreter. So these patients unlikely speak Spanish, English as their first language. So it is like a cultural barrier for you and with them, but it feels it's very rewarding at the end when you're like providing them the eye care that they deserve, because many of times it's their first time they had an eye exam and done by you.
Excellent. And Bree, can you take us home with year 4?
Yeah, of course. I'll also talk a little bit about like how externships are like chosen, because I know
Yeah.
that's a common question as well. So when you're at the end of where Sarah and Miriam are right now, they just chose their sites for the following semester, like following May, I believe, is when they start. So you choose your sites based on a list of available sites given to you by our extern director. One of them has to be a VA or a Veterans Affairs association. One of them has to be a health center, and the other one can be whichever you choose, kind of like up to you. So once you get into that fourth year, once you're assigned your rotations, and again, you get to pick kind of like your top 3 for each kind of specific site, I guess. So like 3 VAs, 3 CHCs, and 3 kind of your choice. And then she'll assign you whichever's best in whichever orientation she needs to. So that everybody kind of gets their top choice as much as she can. And then you're off on your rotations come May of your fourth year. So you're done part 1 of boards at that point, and you're basically just working like Monday to Friday, 8 to 5-ish, depending on where you're at. And you're just providing eye care and working alongside the doctors of that clinic. And our first one we just finished, it's about 16 weeks per rotation, and there's 3 of them total. So you'll start in May of the year before you graduate, and then you'll finish in May of the year you do graduate. And it's such a crazy experience. I thought that I was ready for it when I exited my third year clinic, and I had no idea what I was going into. But now being done one of them, I'm absolutely like so much more a better clinician than when I was 4 months ago. And it's just insane how much confidence you gain and how much, I don't know, patient interactions you gain. You think that you're seeing like, I don't know, 100 patients in third year, and you're like, oh, I'm doing so good. And then you get into your first rotation, you're seeing like upwards of like 400 patients, and you're like, whoa. So it's a great experience. And as you go through the 3 rotations, they're all so different. And it's great to just kind of get out there and see what the world is going to be like after you graduate.
Yeah, absolutely. It's like you're the real deal once you get into 4th year. All right. So I want to talk a little bit more about your academics. Could you guys tell me what maybe your favorite class has been so far at MCPHS?
I definitely liked clinical binocular vision 1. So it's mainly like you talk about the binocular vision disorders. Basically, what that means, when you have two eyes, you want to make sure they work together, seeing one clear and single image. In some patient populations, either they were born with it, there was trauma, something happened that results in their eyes to not work together. They may see double, they may experience eye strain, tiredness. So that's basically what that course was about. It really kind of like opened my mind to like another aspect of optometry. I did have an understanding of binocular vision, like the disorders in the past, but like after taking that course, it was really interesting to see like how much of optometry that like exists other than like actual like true diseases of the eye that we manage and treat with actual like medication and stuff.
That's awesome. Fascinating for me to hear too.
I definitely liked contact lenses. And so just some people come in for cosmetic fits, which is like they just don't want to wear glasses, they want to wear contacts. And then we learn about the patients that like have a medical issue, like keratoconus or other like corneal thinning disorder or whatever it may be. And just the fact that we can go beyond like glasses is just it's just so fascinating to me that you can put on this like piece of plastic and the patient sees like so much better, their life improves, they can continue doing the things like they need to do and they want to do. And so right now I'm in consequence clinic, so I'm super looking like so much of this semester coming up. And that's definitely been my favorite class. So consequence, when you learn about like the soft lenses, kind of like the basic soft lenses and some of the gas prime lenses. And then in consequence, too, you get more into the specialty lenses, people that need them for medical conditions and things like that.
Excellent. And I guess on the flip side of that, what has been your hardest class?
I would say for myself, probably anterior segment. That's a course where you're learning about basically any disease that can happen to the front of the eye ever. So it feels a little bit daunting at first. It is definitely a lot of material, but it's one of those things where once you learn your study methods, once you learn what works best for you, you really just have to kind of grind it out and make it work. So once I understood that the tables were really helpful for me in kind of categorizing things into certain structures on the eye, that kind of made that class a little bit more manageable. So definitely doable.
Any more hard classes that we should let them be aware of?
Posterior segment is also one of the more challenging ones. However, I enjoyed it, and I know a lot of our class did as well. So kind of similar, you're learning about all the diseases of the posterior segment or the back of the eye. Again, very daunting, but Dr. Imperioli, who teaches it, is phenomenal. She really breaks it down. She makes you understand the pathology of it, and she makes it make sense. So again, very doable.
Great. And speaking of one of our faculty members, who is your favorite faculty member and why? We won't share this with them, so.
Okay, Dr. Imperioli. Dr. Imperioli is great. She's always there for you. If you have any questions, she's more than happy to answer them. She helps out in lab. She helps out in clinic. She helps out in classes as well. She's just always available, and she's such a wholesome person to talk to. And she's just amazing. We love her.
And you're not just saying that because she's a Canadian as well, right? Awesome. Anyone else, guys?
I would have to say Dr. D'Amico. She's a great person to go to for like life advice and practice advice. She teaches a practice management course your third year. She also teaches ophthalmic optics, so I've had her in like the optics realm as well. Not only is she's funny, but she's also just the type of person who will tell you how it is and kind of give you a rundown of like what to expect. She's very like straightforward and very honest, which I appreciate. And also just like a fun person to be around.
We do have a lot of fun faculty members to be around, so there's definitely no shortage of that. Now, a common question that we get asked a lot is about research. A lot of prospective students are looking to go into research. I know a couple of you guys have worked on a couple of research projects over the past couple of years. Can you tell me about what you've gotten involved in, just briefly?
I can chime in on this one. So I work with Dr. DeLiso on a study called the Multi-Periscopic Prism Study, and we do this in collaboration with the Scapins Institute, Mass Eye and Ear, and Harvard Medical School. So Dr. Eli Pelly, he invented a type of prism lens, which for people who've had strokes or other neurological conditions, they lose kind of like half of their visual field. And so these new prism glasses, what they do is they bring the image from the blind side into the kind of viewing and their like seeing side or their viewing kind of side. And so it's been really cool because there's been like a lot of prep that goes into the research before we see patients. And when we see patients that have kind of stroke related like vision loss, it's just really amazing. Like some patients like they start crying when you're doing the study and things like that, just because you're helping them out. I know. I mean, I kind of started crying too, but so you put the glasses on them and like the image like shifts into their seeing field, and so like they're able to do a lot of things that they kind of lost the ability to do over the time after their stroke and other neurological conditions. And so we've been working on that study. It's very exciting, sad at times, but very, very rewarding. So that has been kind of a highlight of my like education here at MCPHS, and I hope more students can be involved in it if they can.
Absolutely. We're really lucky that we're in Massachusetts, which is the forefront of a lot of medical research. So it's been really fascinating to see that in particular come through our clinic. And Miriam, I'm so glad that you talked about that because I know you're very passionate and it's a really cool thing that's been happening on campus. So thank you for sharing that. So if you do want to get involved in research, there definitely is a lot of opportunity for you. Now, shifting gears a little bit, I want to kind of focus on what clinical is like a little bit more. So can you tell me about your first clinical experience in the program and what it was like to see patients for the first time?
Definitely nerve-wracking for sure, but I don't remember my first patient. It wasn't a traumatic experience. I just don't remember the patient. But at the end of the day, like as we mentioned earlier, you are exposed to the clinical experience very early on in the program, the beginning of your second year in the fall. You're basically either like doing exams on each other early on, and then you're kind of having like your first full-on patient sitting in your chair. You're expected to do like the regular entrance testing. You give them a glasses prescription. You check the health of their front structures of the eye, and then you check the eye pressures. You basically are expected to see the entire patient. However, you have so much support from the people, like the students above you in the third years, any fourth years who are on rotation at the school, and even the preceptors, because they all know that they were in your shoes maybe 2 years ago, maybe 10 years ago, but they know and understand that seeing your first patient is a lot. And it's a great rewarding experience. And I do tell like all the classes below me that these patients, they're here because they want to get an eye exam. They don't know if you're making a mistake. You may know you are making a mistake and your preceptor may know that, but the patient does not. And even if you make a mistake, you're here to learn, and you know next time that you will not make that mistake again. So again, very nerve-wracking, but at the end of the day, like you do kind of like get over the nerves and you're like you get excited to see like a patient every week. So it's a great experience early on.
Excellent. That's a pretty good overview. Miriam, it looks like you're about to jump in too.
Yeah, I was just gonna add on to what Samira was saying. Definitely like it is nerve-wracking, but one important thing to keep in mind as well is like you have all the support that you need from the very start of seeing patients. Like yes, you're thrown into it and you expect to kind of do like half of an exam to a full exam on like first couple of encounters that first semester, but the preceptor is there to like walk you through it if you need to just meet you where you are at your level. And so, and then as you progress through the program, like obviously expectations are going to increase because you're starting to become like a real doctor. But again, they make the expectations clear and you learn so much throughout the semesters. It's insane how much growth we have, like from day one of the semester to the end of the semester. And so again, like we do get the support that we need. And I feel like that's really important kind of in this program.
Excellent. Thank you, Miriam. Now, we're really passionate here at MCPHS about really capturing that full scope of practice of an optometry career. Can you guys tell me a little bit about the different specialty clinics that you get exposed to while you are a student here? Which typically I would imagine you get exposed to in your third year, if I'm not wrong.
I can probably speak to that. So there's contact lens clinic, which Samir mentioned. Miriam also mentioned it. She's in it right now. You're basically seeing patients just for contact lens exams, whether it's their first time wearing them, or if they're lifetime wearers, or if they're even just being fit for a new scleral or a new gas perm lens. Like we fit all of them, and you get to have the ability to use all of our contact lens fitting kits, which you're not actually probably going to have in real life, because Dr. Stam is awesome and he has all of the contact lenses you can imagine in that one room. So it's great because you get experience with all the different brands and fitting different people, and that's really fun. And then there's also a low vision specialty, which you can rotate through. You're basically, again, working with patients with low vision, helping them with different tools and such that they can use and take home with them to make their daily lives easier. That like reading the newspaper or using like a screen to help them, read an iPad or, anything that you can really think of. Again, like we have options for that as well. And you kind of walk through with a patient and get their expectations for what they want to gain out of the experience. And then you kind of guide them there. And they are longer exams, so you do get to take your time with the patient, really connect with them, and it's very rewarding. There's also glaucoma clinic, which is really fun because you might be on the primary care side of that patient, referring them to glaucoma clinic, and then you get to see them again in third year for their glaucoma evaluation. So we do evaluations, follow-ups, we run fields. There's also a laser, an ophthalmologist who comes in and runs laser once a month. And so if you're a fourth year, you get to help them out with that. So that's also a really fun clinic to experience. And then there's binocular vision and vision therapy and pediatrics in the end of the clinic, which is also really fun because you get to kind of learn how to do an exam that you've been doing forever on like a 5-year-old. And although it can seem daunting, it is really fun and rewarding. And you might find out that you like to work with pediatrics when you didn't expect that in the beginning, like Samir. And then also like binocular vision therapy, you get to work with patients who have had like TBIs, you get to work with patients who have had recent strokes, for example, and just kind of guiding them how to train their eyes to work together or how to kind of do exercises that they can take at home just to kind of improve their overall depth perception and basic visual functions that we all take advantage of because we don't realize that we have them until they're gone. So a ton of experiences in clinic and really, really lucky that we get to experience them all in one building.
Absolutely. Thank you so much, Bree. That was great. Now, I know that, Sierra and Miriam, you guys just put in your options or choices for externship. Is that correct? Can you guys tell us about what that experience was like and how you chose these different sites along with, what is available for students?
Sure. So I know Bree hit on it a little bit, but in terms of your externships, you do choose, so you have 3 of them at the end of your 4th year. And so one will be in the summer months, another in the fall, and then the last one's in the spring, leading up to ultimately graduation. So one of those externships is going to be a VA or Veterans Affair. One of them is going to be a community health center, and then the last one's an elective. So we have, I don't know an exact number off the top of my head. It's probably like 80 different locations you can choose from, and they range anywhere from right here in Worcester to Alaska, California, Florida, really all over the place. I have some friends who are looking to go to Utah and Colorado. So really anywhere that you can imagine, we have a rotation spot for you. So how it works is it is a little bit like a ranking system. So you do pick like your top 3 for each criteria. So for a VA, a health center, and elective. And then ultimately you get placed hopefully in your top. But if not, our clinic or externship director is usually able to put students in their second choice. So really making sure that they have one of their top 2 options. And we should get those back within the next month or so. So that's really exciting. So that'll be about October, and then we'll have all the way till May to figure out things like housing, how we're going to get there, kind of the logistics of how we're going to start those externships, which Bree and Samir are kind of in the process of now.
Excellent, thank you. Now, of course, a big part of optometry school is board exams. So we have 2 of you here who have taken a couple of your board exams so far. So Bree and Samir, could you guys tell us, what the faculty has done or the department has done to prepare you for taking your board exams?
For sure. So as we know, like boards, national boards part 1 tests classes and knowledge from optometry school from the first 3 years. So the school does a great job teaching like the foundations early on in their first year, and with all the basics of optometry, basic anatomy, basic physiology. They're all taught at a decent level. The school is always open to our feedback. So after hearing different criticisms and feedback, they are improving these courses to better suit the changes that we, like my class or the classes below me, have felt about part 1 in the future. So overall, the school does a great job the first few years teaching the basics of all the diseases, optics, anatomy, basically anything that can be tested on part 1. They also do offer a boards part 1 prep course that the 3rd years take in the fall semester that Sierra and Miriam are taking this semester. School has, I guess, like weekly quizzes based off of different topics that are tested on part 1 of national boards. From what I remember, is that what they did last year? Not sure what they're doing this year, but probably something similar. The school also offers like a mock board exam that's offered in the fall of their 3rd year. Basically, that's to like give the students in their 3rd year kind of like a taste on like what to expect, because part 1 itself is about 350 questions. So it is split up into a morning session and an afternoon session on both the mock exam and the real life like national board exam that the 3rd years take in their spring semester. So overall, the school does a great job, and I feel like they're always open to feedback and criticism. So they are improving their ways to further make us feel even more prepared for taking part 1.
Yes, that's definitely been a really big focus of the department is strengthening those board scores, and we've seen a lot of progress with that. So it's been exciting to see these initiatives transform positively. Nabri, you looked like you wanted to add a little bit more to this as well.
I also wanted to touch on part 3 because it's not really on everybody's mind, but part 3 is also really like in there. You take it anywhere from like August to kind of like March of the following year in your 4th year. And I think that Sarah and Miriam probably have a better kind of take on what the school has done to prepare for it, because I was talking to a person in the class below me, and they've done a phenomenal job with like courses about kind of like clinical expectations, and you kind of have like mock cases and all of that sort of thing. But they also have a part 3 room at our school. So if you are rotating at the school or nearby, you do get to drop in, and it has all of the same equipment that you'll see in the part 3 room on your board exams in North Carolina, because you do have to fly out for that. So it's great because it's a specific slit lamp, specific VIO, and kind of specific machinery that you'll find at part 3. So it's great to kind of get your hands on that before you go, just to understand how the slit lamp works. But I'll let them talk about like the courses.
One of my favorite courses that we've offered is our integrative seminar that we had. So this was this past semester we had it. And what it was our professor kind of broke us up into groups of 4. And she would come over and say, okay, I have a red eye. And then we would have to ask her every question under the sun until we figured it out of what it was. So we would ask things like, which eye is it? How long has it been there? Really trying to dive deeper. And then we could ask her, like, can you show us a picture of an OCT, depending on what it is? And they'll give you any feedback or any information that you might need. And it's set up very similarly to Part 3 boards. So we felt like that not only helped our clinical skills, but really helped kind of understand what we were learning and putting it into like one big puzzle together of like a person. And then also obviously helping in that board's preparation.
And just to add on a little bit to what Sarah was saying, like in our schedule right now, like our class schedule or clinic schedule, we have like specific boards prep time built into our schedule. So it is mandatory to show up. And so we can practice for Part 3. And so I feel like that's really amazing because it's kind of an expectation that we're already starting from this point to practice for Part 3, even though we're going to take Part 1 first. So that's already built into our schedule.
Absolutely. The faculty do a great job at making sure that you guys are feeling prepared and are actually prepared for going into each of these parts by building things into the curriculum that will help you with that preparation. In addition to that, the university does have a lot of different resources that are available. I know a couple of you are peer tutors as well. Can you tell me about what that is and what's available to students who may be struggling academically?
So I guess I've been tutoring for maybe 3-ish, 2.5 years right now. As a 4th year, I can tutor class like the class below me. So I'm able to tutor like 3rd year classes, whereas a 3rd year tutor is able to tutor 2nd year classes and so on. Ultimately, you kind of have to like get a certain grade and possibly like a recommendation from one of the professors to kind of tutor these specific classes. At the end of the day, like these students, they may be struggling, they may have clarifications. For one, I know when I was a 1st year, I felt that going through a tutor better explained the concepts like in their own words versus what a professor taught me, which made it a bit more clearer to me and understanding why I was like getting confused on a certain concept, maybe because it was explained in a different way. There are also tutors for our like lab skills. So like optometric theory and methods, it has specific like lab tutors, which are current 3rd years or 2nd years, depending like which course, and they're offering like in-person, in-lab tutoring after hours, just to make sure like the students who are taking that course and that lab are feeling safe enough and they're prepared enough that like they are doing the skill correctly, because at the end of the day, they will also become an eye doctor, and those students want to ensure that their skills that they're practicing are being safe enough and correct enough that after being watched by a lab tutor. So it is a great experience that an opportunity that the school does provide to students in the classes below us. For one, I know that I use it a lot for 1st year, and I know that students who do use the tutoring services feel like they have a great experience with any of the tutors, whoever they book with.
Excellent. Thank you so much for sharing. And now I kind of want to talk to you guys about, life after MCPHS. What are your career aspirations with optometry? Are any of you thinking about residency, or do you want to go into some sort of specialty? Still thinking about it?
Such a big question, Hannah. Currently kind of everything's up in my wheelhouse. Everything's kind of like laid out on the table. So I haven't quite decided whether or not I want to do residency, really where I want to practice. So for me right now, it's just about getting more clinic experience and learning a little bit more and taking boards, obviously. But I'm sure that once I get a little bit more into glaucoma clinic, BV clinic, peds, contact lens, you name it, I'll start to see if that's something I really want to pursue.
Totally understandable. You're just tackling what's in front of you for the time being.
it's funny, this was a question of the day at my first day of my second rotation today. Every single doctor has asked me what my plans are for after graduation. I do want to do a residency and then I want to go back to Canada. The thing is, everybody in Canada is super healthy, so it's very rare to see like any kind of disease in their back of the eye because when it's first caught, it's treated right away. Unfortunately, there's a lot of different populations within the United States who do have so many eye conditions and like regular systemic conditions that may present within their eyes. I loved ocular disease classes that we had at MCPHS, so I really want to see as much of disease possible here within the residency and then ultimately go back. What will I do when I go back to Canada? We'll figure that out after.
Just like Sierra, one thing and then, on to the next. So wish you luck with that endeavor, Samir. All right, so just one final question to close off this session. So of course, many of the prospective students that are going to be tuning in are, thinking about their future career as an optometrist. And you guys were in their seats just, a couple of years ago. So what advice do you have to admitted students who are looking to pursue optometry?
I'll go first because I have two pieces of advice that I give literally every single person I've toured or whichever. Number one is before you start school, make sure that you do shadow. Anyone doesn't have to be like the best optometrist in the world, just literally shadow an optometrist or go get an eye exam for the first time or just anything. Get in that environment so that you know that's what you want to do. And number two, once you get here, realize that you're in it for the long haul. You're in it to study for life. You're not studying for the exam anymore. You're not studying just to pass your midterms, your finals, whichever, your board exams. Yes, you are. But in the long run, you're studying so that you can be a doctor. So take everything you learn from your exams and your classes and even what you study for your board exams with you so that you become a better clinician. When I was just on boards, I was like at my peak. I knew like so much and I was so proud of myself because I had all of this knowledge that I just learned in optometry school, just like at the tip of my brain. And it was just great. And so I just thrived to have that kind of knowledge every day. So just keep going, keep up with it. Don't lose anything. I know it's hard and it's a lot, but just keep with it.
Excellent advice. Anything for the interview for our folks who may be interviewing soon?
I would say just honestly like be yourself. That's why you got an interview in the first place. And so because the interview is more of kind of a conversation like to see kind of like why you want to come to MCPHS and be in optometry. So I'd be prepared for like those questions: why MCPHS, why optometry? Just be yourself because again, like that's why we want you here. So I feel like that's one thing that a lot of people kind of like get nervous about. But if you're yourself, like that's the best version of you. So do that.
Wonderful. Well, thank you all so much for your lovely thoughts and everything that you've shared with us. This has been great, and I hope that it helps a lot of our prospective students who are considering attending MCPHS and becoming an optometrist. If there's anything that our friends here did not answer that you're still curious about, you can get into contact with me and I'd be happy to put you in touch with one of them as they are a very helpful group and I'm sure would be happy to talk to you. But yeah, we look forward to hearing from you all and wish you the best of luck with your application process. Thank you. Bye.